I'm extremely happy. I cannot imagine this moment when it is done in Maharashtra and in Pune, which is Punya Nagari, the cultural capital of the Maharashtra, and even our Kolhapur also. So I would like to start with Dr. Vatsa, who are not there today with us, but I'll say about that little later. What I wanted to say, I remember a poet from Kashmir, Firdos. Gar baruye jami asta, gar baruye jami asta, hami naso, hami naso, hami naso. अगर पृथ्वी पर स्वर्ग है तो यहाँ है और यहाँ है, और आप सब भागीदार हैं, जोरदार तालियां. Started from 1970 to 80, and one fine day, the phone came in a very sexy voice. During those days, we had a net app. He said, "You are Raj Shekhar?" I said, "Yes." He said, "I have received your name. Can I call you and can you meet me?" Of course, I'll come and meet you. That was a turning point of my life. That was a point, and afterwards, rest is the history which all of you know. And the person who was responsible for that turn, fortunately, is my friend, philosopher, guide, and a legend. Please join with me in giving a big hand to Dr. Prakash Kodkar. Good thing in me is because of all, and what is bad in his mind. I really, and what happened? That after his talk, there was a premature felicitation, I feel. And suddenly everybody went out for a tea, or I don't know for what. Some of them went on the other side also.
मुझे उसकी ये है कि कांटों से भी प्यार किया है कभी कभी, फूलों को भी शर्मसार किया है कभी कभी, अल्लाह रे बेखुदी तेरे पास बैठकर तेरा ही इंतजार किया
I will tell you, not that because he is here and I am here, and when he is not here, he has witnessed 7th World Congress of Sexology. We are trying for last 5-6 years to get some sort of foreign people and have a conference here. Can you imagine 1985, when there were no mobile phones? He had his friend with the fax, at night we used to talk to the people. And imagine the whole of the Taj Palace. We had taken 3 months, we were there. Last 3 days, we never went out of our suite. That is the type of work, and I can tell you, I have attended many workshops that cannot be parallel to that. 6 halls were there, all of them were full. Can you imagine? All credit goes. We take, there is no doubt. गवाह है वो गलियां अभी तक जहां हमने हमारी जवानी लुटा. So somebody said, "Sir, can we put it on vibrator?" I said, "यार पर कैसे vibrator? नहीं फोन हमारा ऐसे don't do that vibrator. Silent mode पे रख लीजिए." Secondly, somebody asked me, "It is a workshop, are you going to give some sample at the end?" No, I don't accept. Third part, most important part is a workshop. What is the meaning of workshop? What Prakash did, a workshop, and we have done lot many workshops together. At 7th World Congress of Sexology, who were there? John Money. Then our friend, Ropikaro could not come. Prem Mishra was there. Hartman and Vidya was there. Then our Damir Walchek. And so many others. I tell you, we have never seen such a workshop. And when I went abroad, I was lucky to have Alan Kaplan and John Bancroft. So workshop means you are giving hand-on practice. It's not just a lecture which we give over. And that's what I would have done. I have attended many workshops. And out of every workshop, you will learn only one point. And gather all like a bead, and then it will become out. So all these years, I have done gone to Nepal, Bangladesh, Sri Lanka to conduct the workshop. And I am very happy again that I am in Pune 2020 at the Sarson Hospital. I was talking to the all postgraduate, I'm just an MBBS. And how many of them? 8 medical colleges into 6, 48, 6 doctors, who were their teachers. So totally days people, and I single-handed took the workshop 18 hours. And at the end, very deep session came, Mohan Agas. He said, Raj, if I would have known, I would have been. What I am giving you today is just a glimpse. What you have to learn from Prakash. Nowadays, I go to so many workshops and so many conferences, all gazettes. Sex is not between here, but in between here. And that is the most important thing. Unless and until you know how to take a history, now I'll tell you how to go about communication. And I can tell you hundreds of cases. First comes communication, and if you go to communication, I can tell you, you can do a balance. Your personal life, professional life, social life. Just to give you one funny incident, Dr. Nath is here. When was our last conference in New Bombay? 2014. So he, and who was the world president? Wiley. So K.Y. Wiley wanted to see the Mumbai. And he thought Raj will be the best person. He said, you stand at the, where Bart Hacker said just opposite. He will come from New Bombay and he will join. So I took him. When at the time of lunch came, I was worried because I was vegetarian, I don't know what to do. After 3 words, I understood he wanted me to khali, vegetarian. I said, very good. We went to Samla. And in the evening, Dr. Narayan is here, you, Dr. Vatsa and Dr. Prabhu were there. So we went little early. We were sitting there. Then the white fellow only wants to have a drink. At 7:30, 8 o'clock when the bar opened, we rushed him. And then there was Guskus start. Dr. Vatsa said, Raj, only you can do it. I said, what is the problem? He said, he's in the shorts in the morning and there without trouser you cannot enter. Now where to get enough willingness? So I used my communication skill. I went to the manager. I said, sir, and that time it was the Modi wave. I said, I need your. He said, what can I do? I said, what? Modi cannot do it, you can do it right now. He said, tell me, I will do it. I said, I want one trouser. Trouser? What do you mean by trouser? I said, I want a trouser because this is the problem. So where to get? I said, you have got so many of your weaknesses. Look at one of them. The moment I came with the trouser, Dr. Wiley, can you believe in the lobby, he started removing and wearing. And I was like, man. So I can tell you hundreds of such cases, but let's start with it. I start with Kamadeva, the god of love. And the second one is, me and Prakash read the Kama Sutra, ancient yet modern. And Prakash, from that time onwards, every 2 years I have been reading, doing something, and it is like a मर्जी जो सी में जाके वो बुद्धि लेकर आता है हर टाइम I get something. So we are the people who have given the world Kama Sutra. So let's start with a prayer of Lord of Kama Sutra. Before I start, a counseling, a first skill for a sexual medicine practice. Now before I do, can I have at least one role play? I want 2 people. एक Aurora or if somebody who is no, I want somebody who is absolutely fresh. Who is the person? One person who will start. Prakash has already taught us how to do the counseling, how to do the history taking. So straight way you start. How do you, once he enters, what are the things you are going to do?
Please come in. Please have a seat. आप कौन सी भाषा में कंफर्टेबल हैं? हिंदी? हिंदी चले, हिंदी चले.
Little loudly, so that people will hear.
आपको तो आप क्लिनिक में आए हैं, तो probably you know my name is Dr. May I know your name? अब सर आप पहली चीज़ मैं आपको बताता हूँ, आप यहाँ पे एकदम कंफर्टेबली बैठिए। इट्स एवरीथिंग हम जो बात करेंगे, इट्स 100% कॉन्फिडेंशियल एंड वी विल टॉक लाइक अ फ्रेंड, दोस्त के जैसे बात करेंगे। कुछ भी आपको तकलीफ रहेगा, कुछ भी प्रॉब्लम रहेगा तो आप मेरे साथ शेयर कर सकते हैं।
जी सर, इसी के लिए
सो आपको क्या तकलीफ है?
वो मैस्टरबेशन बहुत खतरनाक
अच्छा, आपका अभी एज कितना?
है। ये पता नहीं, यही बात का डर लगता है कि पता नहीं क्या तकलीफ हो जाएगी।
तो है इस वजह से आपको लगता है कि आपने कुछ गलत किया है, ऐसा आपको लगता है?
हाँ, सभी लोग ऐसा बोलते हैं।
हाँ, सभी लोग बोलते हैं, लेकिन आपको कुछ उससे तकलीफ महसूस हुआ है?
मुझे डर लगता रहता है कि कल शादी होगी तो कैसे मैनेज करें।
देखिए, मास्टरबेशन जो आप करते हो एकदम नॉर्मल प्रोसेस है। मतलब आपने कितनी बार भी किया होगा, अगर आपको उसमें आनंद आता है या अगर आपको उसमें कुछ भी तकलीफ नहीं है, तो आप दिमाग से निकाल लीजिए कि इससे आपको कुछ हार्म होगा। आपने कभी सुना होगा या तो कहीं पे पढ़ा होगा, उसकी वजह से आपको लगता है कि जो मैं कर रहा हूँ उससे कुछ गलत होगा, आगे जाके मुझे एनर्जी लेवल में कुछ प्रॉब्लम आएगा या तो तकलीफ होगा। तो ये पूरा आपके दिमाग में जो चल रहा है वो पूरी तरह से गलत है। तो
करने के बाद फिर ये टेंशन हो जाता है कि क्यों करता हूँ, पता नहीं क्या दिक्कत आएगी।
देखिए, आनंद आना और बाद में गिल्ट फील होना, ये सब जो आपको जो लग रहा है, ये पूरी तरह से गलत है। क्योंकि साइंटिफिकली आप अगर आप देखोगे, आप दवाखाने में इसीलिए आए हैं, बाहर जो आप सुने हो या पढ़े हो, उसकी वजह से आपके दिमाग में बैठा है कि ये जो चीज़ आप कर रहे हो गलत है।
तो बचपन की गलतियां हैं।
बचपन की गलतियां जो आपको लगती है दूसरे लोगों ने, अभी आप दवाखाने में इसीलिए आए हैं कि आपको लगता है ये गलत है। अभी आप दवाखाने में ट्रीटमेंट के लिए आए हैं और आपको लगता है अगर कि ये डॉक्टर के पास जाने के बाद आपके प्रॉब्लम सॉल्व हो जाएंगे, इसका मतलब ही जो मैं अभी आपको बता रहा हूँ, ये आपके दिल का वहम है कि आपको लगता है जो आपने ज़्यादा मास्टरबेशन किया उसकी वजह से आपको तकलीफ होगा। आप बिल्कुल इसमें दिमाग से ही
Please give them a big hand. What was the problem? One at a time. What was the problem they said? What thing they did good and what was not right? The most easy. They come, young people who is coming in very coming from the north side. Now the things are changing. They feel weakness. The only complaint they come and tell you weakness. So you must see who is the person behind it. Whether a young person, married person, middle-aged person, old-age person. And then you follow biopsychosocial model and then you will be able to do it. But then and secondly you saw that we are meant to say the most important part. Give them a big round of applause. Never been taught to us counseling in our college. And we all doctors supposed to be we are God. बोल दिया ना, कर लो ऐसा, नहीं करने का पेपर फेंक दे. We become a God and we become a father of it. And that is what you see that counseling has a, so much of need. Can anyone tell what counseling is? Counseling नहीं आप तो हमारे बच कर आए हैं रेडियो से. He's from Bahrain. Please give them a big hand. You know Bahrain है. अब आप बताइए. What is counseling according to you?
Take the detailed patient concern or history, what problem he has.
काउंसलिंग कर रहे हैं बेटा, कंसर्न की बात ही नहीं आ रही है अभी. काउंसलिंग का मतलब क्या होता है? हिंदी इंग्लिश जो भी आवे आप.
Creating a safe space so that a person can speak.
Person can speak. My wife always creates a safe space, but then she fires me, at the end of it. How can I say that it was a safe one? Anybody else from here, please?
Psychological conditions or the problems, any problem.
Okay. Finding the problem and helping them, I think give them a big hand. There are so many types of things. Failing in their practice. Because they do not know how to communicate with the people or the patient. And we don't use in a sexual medicine patient what we use the word client. in counseling, because they are not sick people. They are the client, they have come for their problem, and what are problems we will see. Now, how the communication occurs? This is how communication occurs. Now I am talking to you directly. What I talk, what language I talk, there were some disturbances I stopped it. All those things. Suppose Dr. Vadia wants me. Then he is in Delhi, I am in Mumbai. Now he sent me to the mobile. There is no connection. It goes to via satellite. He can send me text, he can send me photographs, he can send me money, he can send me voice. So many things are happening. So one side there is a sender. Now from here they are giving the message is going. It's encoded. And there may be the noise depending upon suppose the satellite is not available. Today morning I saw the moment I switch on the TV, they said you won't be able to get because of the cloud and everything. And it is a media through teaching. And decoding is a record. And then the communication was coming. If you have seen on the TV when they are doing on the right on the spot, particularly when the touch was wrong, they say I am at the zero spot. This is what is happening. And I am so and so over. Then the person who is there in the studio again says, same thing in the mobile van. Alpha speaking, I am at this spot. Problem is that by looking go there. Roger speaking karke baat. So there is a sender and receiver. Now what happens over here, most important part is what I have been taught from the childhood. We have been taught the communication with the time, training and behavior. Our training from KG classes, college is writing. Our all exams what we give is in writing. In medical and other things, a small reading also right from KG to the special training which you do. Speaking, 30% when you take up a special job, then they do the training of the trainers. And 45% are listening. And all of us, including myself, we are poor listeners. The moment the client comes to you, he wants catharsis. Nobody is there to listen to them. Let that person vomit out. You know who is Persis Kapata? Can anyone tell me? Jockey. Huh? Model. Model, what's in the model? Okay. Where was she? Fellow colleagues,
She's a cancer survivor and a model.
model. And what was the best thing about her? Bold. She was an air hostess. Why she was bold? No, not because of cancer.
Bold.
She needed a job in a Star Wars.
Yes.
And that's why she shaved off her this thing. And she wanted to come at the top of her life to India. So Kabir Bedi was interviewing, he said, why you want to come to India? He said, very simple. In America, there is nobody to listen to except the psychiatrist or psychologist. So what they want, the moment you tell them after making them comfortable, listen to them. Don't tell that it is normal. He said, ये गधा है. मैं तो इतने साल से कर रहा हूँ. Every day I am feeling weak. I am not getting sleep. There is cancer on me. नसें मेरे पे आ गई है. पेनिस का साइज हो गया और ये क्या डॉक्टर है? First listen to them. Half the battle will be done. One of the topmost persons recently died and Prakash was his hand was Ashok Bhai. So it was Siva guy की Asian head. He said whenever the people come लग गए, वहाँ पर reunion बना के आ जाते हैं. First thing, whatever meeting you have, you cancel that. Just a market meeting and all of you are welcome. Chai लेंगे, coffee लेंगे, swimming लेंगे. What are the problems? Don't utter a word right now. Listen to them. 15 minutes, 20 minutes, anybody is. It's very good. We were not aware of it. The moment they say नहीं करना पड़ेगा नहीं तो तू बोलेगा कल से बंद कर देंगे. So how to do this? Follow when you go home. Listen to your spouse and she will say it is changed. Every time you should put the CSEPI. Okay. This is what 45 the listening is there. And that is the most important part which we are going to listen today. Now, what are the types of communication? Recently at Delhi, I did again 3.5-hour workshop and I have given so many details of verbal communication, non-verbal, then writing communication, visual communication and listening communication. And It all started right from the Ashoka Shilalekha, Bhimbetka, they were all paintings over there. Ajanta Ellora, paintings were there. So all those things are written communication, Shilalekha, Tamrapatra, parchment paper, manuscript. These are all written things. And then visual communication, which today now, fortunately, is the best thing. The TV, YouTube, mobile, and that's the worst thing. They have taken away all relationship. And in the morning, previously, I used to take half an hour to clean my room. Now half an hour I to clean up all WhatsApp messages. That is. वो बोला कि इन्होंने अवार्ड मिला है रात को नीचे आएगा RIP कोई दूसरे का चल रहा है अब RIP क्लास का आ गया. That is what is happening. And listening, forming. So different types of communication, and we are continuous. A small baby, the best communicator is the moment child is born. Correct. People are happy that normal delivery or outcome, whatever it is. The first question got the born correct. And then whatever happens, child knows only one language, that is crying. सुसु हुआ है तो भी crying, पेट दर्द हो रहा है तो भी crying, भूख लगी है तो भी crying, गैस हो गया तो भी crying. And the last word at Rajgarh, if you see, if you go into the middle here, that was his communication. Somebody asked Mahatma Ji that what is your message of the life? He said, my life is my message. What you do is a communication. This is what exactly the whole communication is. The most important thing in communication is to hear what is not being said. Now, our friend Rick, who came as a client, he said weakness like that, so masturbation हो गया, but generally weakness. The client comes, he is creating weakness, he is feeling, lost, not able to concentrate, dark circle, यहाँ पर दस है, पेनी स्टेडी हो गई है, वीडियो पतला हो गया, all these things. What he is not telling you is I am masturbating, and I am hooked to the masturbation. This is you are going to be bread and butter of three things, masturbation, gas syndrome, and penile size. If you do this, you are master of the sexual practice. 40 to 50% of the cases you will be able to solve with the counselor. You don't require anything. So that is what. So what he is saying, I am feeling weak. What he is not saying that I am masturbating, and not he. The third person had a case. Why he was feeling, he started closing everything and sitting all the time on laptop. So his mother thought that this is a project. One day, mother's pallu came up and her breast was seen. And he shouted, "Upar laga do pallu." And that was it. Hear the patient. What he is saying, once you hear those things, I can tell you, you will be like a shadow of course. What is not being said, once you know that, and then immediately I found that what, then I called him brother. I said, "Only masturbation karte hain ki kaun dekhte hain, wala kaun." I said, "What we talk is confidential, I won't tell you." That's the first thing he was saying. I said, next part. क्या thoughts आते हैं? We do not have control over the thoughts. Child होते थे, हम लोग बोलते हैं, जेट फाइटर लेके जा रहे हैं. I'm going in a big car. I'm going, on a cricket में जाके 100 runs around. So these are all fantasy. We have no control. Then he says, "Yes sir, I have been masturbating. I have been told my cousin. मेरे जैसा पापी कोई नहीं." And when he saw the mother's breath, he was so disturbed. So what patient says, what patient wants to say, and what patient does not say. Patient says, "I am feeling weak." What he is not wanted to say, "I am masturbating," and what he doesn't say, that I am feeling guilty. There is nobody like me who is all the time thinking of mother and sisters and all. This is how you go about. That's the most important thing, the non-verbal. And you will be surprised to know, I took 1 hour to teach people non-verbal communication. अगर यहाँ पर कोई ऐसे बैठा तो पहले उसका बात छोड़ो. And I showed all the pictures how Murni met. ट्रम्प से कैसे मिलते, बाइडेन से कैसे मिलते, गुरमुख से कैसे मिलते, अमित शाह से कैसे मिलते, और अपनी माँ से कैसे मिलते. And if you see the now when you go home, see that when two top leaders are meeting, or when somebody is put on there, look at their body language and other things. There's a complete, it's very difficult. So the worst was if they are a good actor, Clinton said, I did not do it. And no expression on the face. Sometimes body language also is very difficult to understand. But that is what we have to learn about. And his unspoken language is more than spoken words. Now, we all know कि काउंसलिंग वाला पेशेंट आ गया फ्रॉइड का साइकोएनालिसिस करेंगे hypnotism. You know where hypnotism, the birthplace of hypnotism, can anyone tell me? Where was it? Who started? This is what happened. Me and Prakash, when gave a World Kama Sutra discuss, now everybody is discussing. Ave Faria. If you go to Goa, go to the old secretariat, and he is hypnotizing, there's a picture, you know, Ave Faria. Same statue is there. And if you have seen the movie, you know, of Ajay Devgan, what was the Singamala? The last scene which are being shown, you know, is around that time. So hypnotism is there, behavior, how will we know it, translational analysis. But the most important for all of you is a learn implicit, permission giving, limited information, specific suggestion, and intensive therapy. If you can't handle, give it to the other people. And last but not least is civic. And where is Nilima? She is sitting at the bench. Just please get up. What I have told her, we are going to be another 7 days together. And I said, please teach me civic. Civic is anything, mindfulness is anything. And once you learn, these are the weapons in your armament. So I am going to give you alphabet of counseling. Once you learn, you will be able to do anything. आपने ABCD सीख ली, ऐसे लिखिए, स्टोरी लिखिए, legal thing लिखिए, love letter लिखिए, गालियाँ लिखिए, exhaust. But this, what I am teaching you, is the most basic. And when you meet next year, you tell me the topic will change in your personal life and a professional life. Coming back to what I do, I follow Carl Roger, and he is my few gods. Kamdeva, Vatsayan, then I come down to the Freud, Masters and Johnson, Kinsey. And one of the great person is Carl Roger. Said you give a client more important, not that you are important and you give them. Same thing Michael Bellitt had done in UK. He said is Michael Bellitt, there are pills, problem, patient damage, and physician. The most important part is physician. If I give you a sitar and if Pandit Ravi Shankar plays the same sitar, it will be different. If I give you a bat and if Virat Kohli plays with the left bat, it will be different. If I give you a dialogue and Kaun Banega Crorepati kitno nahi kiya, but nobody could compete with Amitabh. So the same thing, what is required is warmth. Second is genuine. आप बोल कर रहे हैं, बोले नहीं है. I'm somewhere out, I'm in Delhi, I'll meet you. Genuine, they process it. So you have to be genuine. Then empathy. What is empathy? Can anyone tell me? What is sympathy, apathy, and empathy? What is sympathy? इसको गिर गया, कितना दुखी हो गया. Sympathy, it's just a daya, बिल्कुल. Apathy and we are blissful. And that is what all of us, including myself, are doing. There was a signal, I don't drive, वो signal बंद था. 1.5 महीना बंद रहा, nobody is there. Everybody is there. कचरा के पड़े हैं, nobody wants to do anything. When you go to Japan, some Japanese came to India and said, what is happening? बोले ये young people क्यों बैठे? बोले कुछ काम नहीं है, काम को बोले इधर जितना कचरा पड़ा है उसको उठाओ ना. That is called apathy. And empathy is feeling what this gentleman is doing and how he is feeling. I was invited at Thane, that big hospital, Singhania. It is destroyed now. I was a chief speaker. In the evening, they had brought for me champagne. Then also they brought caviar. They brought Kolivada se Singa leke aaye the. Islampura ki chicken biryani or mutton biryani. And then बड़े मियाँ के कबाब. ऐसे मैं इनके का कुछ नहीं खाता हूँ. इनका स्पून भी मेरे खाने में पड़ा तो नहीं. Get me 1-2 केले, 17 यार नारियल. So that is what putting yourself in another person's shoes. Then you understand what is happening. And the most important part, if you don't layer anything from me, positive, ये जो है unconditional positive regards. My hands are always open. Even if they are angry with you, go. But my hands are open. And I'm always there to help. So if you do this, I think, and above all, what your Dr. Vadia will understand better. That whenever we go now, we have got the one commander in chief who looks after navy, air, and infantry. Previously, they were all separate, so there was no communication. So what you need is military, then your navy, air force, and most important part is your raw. Or our great man. What is his name? Huh? Dole, Ajit Dole. There cannot be anybody else there. So that is you have to this eclectic. अब कल मिसल खाना सब चीज मिक्स करके वेल खाना. So you have to use every time when you think whatever. There are people in USA, they only do assertive. People who leave the rhythm only this. I have depending upon it. Various things. And that's why I said attend more workshops. There should be more workshops than the lectures. Now the first counseling was done about 30 years back. I was invited to Raj. And I was taking PEDA over there. And they said, sir, come up. The thing has already started. It was a hasty hall of Rajkot, bank. I went there. I was worried. The president was Dhami Sahib. He was the speaker of the assembly. And vice president, तो नाम आए तो एक तो गर्ल का नाम नहीं था, हिमानी. That's the president साहब, हिमानी बहन बोल दिया, sister हिमानी. And there was a laughter. They said हिमानी is a man, इतना बड़ा, फिर मोदी के जैसा बड़ा था, वो खड़ा हो गया. वो बोला राज है, राजकोट है, तो मुझे रानी बनने में कोई जरूरत नहीं. And I told them that I have always taken Rajkot with me. I am a Raj, always wear coat. That's why Rajkot is divided as a Karya. The most important, the first counseling in the world was done by Krishna. Look at this. Arjun, Arjun knew that he was, what was Krishna God? Middle of the Mahabharata. And don't see from the religious point of view, whatever may be your religion, try to understand, I try to understand, I have never gone beyond the second chapter. But all your problems are all over the world, top people have said that Gita has given them so many psychotherapies come out from that, that's what they say. So he says, and he knew that he's a God, he would have said, Chalo, Kado, Geleo, or Lado. And he knew that he would be winning. He said, no. It has Karma Yoga, Bhakti Yoga, Jnana Yoga. And what is more important? Ichha Asikra. Whatever you feel good, you take it. Never take a responsibility on it. I had a doctor patient. He was very poor. And then he came with his boss, who was a very rich, but he was a homosexual kid. So he started taking this boy. He said, come on, let's enjoy. And he started getting Taj mein ja raha hai, kal Oberoi mein ja raha hai, Mercedes mein ghum raha hai, Switzerland ja raha hai. And he started enjoying those. Now go back to the Kinsey. What Kinsey say? That time, and now it is seen, 4% of men are exclusively homosexual. 2% of the female, they are lesbian. Then he says, more than 15 to 18% of the people for 10 years of your life or less than that, they had a homosexual relationship. जेल में है, आर्मी में है, कहीं दूर जगह पर है, हॉस्टल में है, बॉयज हॉस्टल, गर्ल्स हॉस्टल. There's no other. But the moment they got a second control, it was just for a temper. And initially, I used to shock the people. I said, 1/3 of the people sitting over here had a one sexual, same-sex encounter. That does not mean that you are a homosexual. And during those days, people used to get the moment you say homosexual, worried. Moment you say he's a drug addict, no problem. Moment I say juari hai, bana. But homosexual. Fortunately, Karan Johar and Dostana has released the whole bitterness which we had about homosexual. And initially I was given most of the talk on homosexual. Why? Everybody thought the moment I go and talk, then they will consider me. Then I am also homosexual. So I was lucky that I studied in a small part which was of no use in USA, and that was in San Francisco. It was just a thappa. You don't need a thappa, you need our people to talk to us. He said, what is the proper ground thing to know? अपनी भूमि की बात. वो लोग जो बात करेंगे, दो लोग मिलेंगे, first they say, second, I'm a homosexual, I'm a bisexual, I'm a heterosexual, and I'm a Republican or I'm this. This is how they introduce. But apne ugly feel. So that is very important. Homosexuality, now that thing is going away, and we are much. If you think any one of us, one third must have some sort of relation, and Prakash always says, there is a Nobel Prize winning is waiting in the. You remember once you said, the one who says I can cure, there is no word cure, it is normal. If I am only wearing a suit over here, does not mean that I am an. If I go to beauty scholar, it does not mean I am a normal person, but in a mind. I show the dot over here, still have it. I think this wall is there, you don't have it. But that does not mean I am an. So they are in minority, they are very complicated. Now we are open, then this comes. And not many doctors have a problem. The moment the homosexual comes, they have one. So what is counseling? So many, you will find. One girl in my workshop, she came from Nagarkoil. And she gave a beautiful thing. Just work out this. Helping people to help themselves. You are doing just nothing. You are just helping them. You are just supporting them. Bringing out them from the closet. Making them what is good, what is bad. If I see in the mirror, मेरे बाल कैसे बने हैं? मेरे चश्मे अच्छे लगते हैं? Whether my tie is okay or not. The mirror is not telling you to do this. Just showing you the mirror. And that is what it is. Can you tell me what is the meaning of catalyst?
Catalyst.
Catalyst.
It's something that instigates the process.
It
begins the process. It helps start the process. Activate the process.
It's an inert substance which does not take part into the reaction. But because of the presence, the reaction becomes faster and positive. So when I always tell when a wife and husband sexual problem comes, I said I'm a catalyst. I'm looking into your bedroom. I'm not taking any part. You are the two who are going to work and discuss. What you have to do, the most difficult part of the counseling comes here, and which initially you get burnt out. As I said, counselor, client, and counseling. And this is how you have to have a sitting arrangement. But the most important that you are a catalyst. After lotus leaf देखे, you are just watching. You are not taking part into any action. So this is the first thing as a catalyst. The moment you start feeling that बेटे को क्या हो रहा है? You burn out. And foreign country, they go to, if I go to Prakash comes to me, we are doing the counseling, or I go to Nath, or Nath comes to me. What is to be done? I am so disturbed because by saying this, you are after all human being. So that worries you so much. And that's why never take up a counseling of your family or the relative. Coming back to, you are just a mirror. Showing them, you are not giving them any idea what to do. You are showing that what is the vital side and what is the other side. Learn into your feelings and let them guide you. Dr. Peter Gordon used to say, "Kursi de do बेटा." हाँ क्या हो गया?
नहीं, we are running behind you.
अब schedule है तो मैंने बोला अगर मैं अभी बंद कर दूँ, मुझे I have no problem. आज time witness है, I will stop it right now. I have no problem. See, two messages. Dr. Sate told me 1 hour you are person. And अभी कितने मिनट हुए? I don't mind. I can just go like that. Now you decide. It's not here, no problem. Now, those who want to continue, please raise your hand. बेटा ये देख लो ये. See, you have done. Have you known how much I have prepared? 3.5 घंटे का तो उसको short किया है. And every day in the morning 5 o'clock I have got up. Each slide is worth 1,000. Picture is 1,000 words. This is a Chinese proverb. I was a dull student sitting in the last. What I am making is the most easy. 44 years experience to you. Not only 44. Moment I was in a college. People used to say, "Docs, मेरा headache patient है, तू जरा संभाल." Because I have a genuine feeling for human beings, I used to listen. So this is the count. But the training and the counseling will bring an entire thing. Okay? So that is what it is. So we go little fast, don't worry. So first of all, you are to be comfortable with yourself. Unless you are comfortable, you should not take up anything at the sexual life. Then, what is more important is command over the subject and a good listener. These are the qualities of a good counselor. It is not giving an advice. That homosexual boy which I was telling you know, with a couple relation, he came. He was his, उसकी क्लास में से एक अच्छी लड़की का आया, माँ का बोला मैं क्या करूँ? I said this is what it is. And fortunately, he was in love with some girl earlier, but he could not take her to drink coffee or take her to give ice cream. So he started that this homosexual relationship. So he has to decide. You cannot give them advice. Then never do warning and threatening. And never do उसको अगर ये जबाने को बोलता था कोई बहुत बोलता था कि ये masturbation छोड़ दो पाप है, so that is wrong. So you should not do that. Now, most important part, all decision making rests on the client. So you do not have to take a decision. Now what is happening over here? First of all, explore. Yes, हम उसको पूछो क्या हुआ. उसके बाद में understand what he is saying. If you don't understand, say that please clarify. I am not. He is saying weakness only. तो आप जो प्रकार में बोला, you write down all the blood report. It is of no use. So what is important is to understand what is happening. And lastly, act. This is the most important part. Unless they act, there is no meaning of the concept. Question and close end. Can anyone tell me what is open end question and what is close end? This is very important. Please.
Open-ended questions do not necessarily have one answer.
For example, if I ask you close-end question, do you masturbate?
Yes,
At the moment you say no, that means in that particular situation you will never say yes. But if I tell you, इसके अलग-अलग नाम करेंगे, मैं बहुत मार से लेके हस्त मैच में बोलते हैं. It is a self-pleasure. Now, what is the way in which you do it? Whether you are doing it bedroom or bathroom, or you are doing it with one or just fantasy. Now, answer cannot be yes. So initially it should be open-end question. And when you want to come down, close-end question. That is what would make a whole difference. Then in the mid-transparent, decision and action, and as I said, decision is always there. The most important part is the action. And action is better working towards it. How are you, Dr. Shirish Malde? And Shirish will feel very good. Next time you go to the bank, Mr. Kamdar is there. Hello, Mr. Kamdar, and Kamdar will look at you who is speaking. So everybody likes it. So try, it's a difficult thing, but try to learn how do you go into the deep. Secondly, be good listener. Listening is not passive. Then encourage them. Now, these are non-verbal. You say, okay, yes, I understand. Repeat word or two. उन्होंने बोला मैं कल मैच देखने गया था. You went to see a match. I wanted to go to the Mumbai right now. There is a big music festival is coming up. So you went and you did not got a ticket in UI by home. Say that word. Then we understand that you are listening to them and you are understanding them. There are so many things. Attending, as I was reflecting and paraphrasing, summarizing questions I told you. Focusing. 10 problem लेके आए, which is the most important part. Immediacy. वो पास की बात करो, husband wife में बहुत जगह आते हैं. Tell them what is gone is gone. You have no yesterday, time has taken away. Tomorrow may or may not be. What we have got is today. The more important is immediacy. Here and now you try to solve the problem. Now rapport building, I say, ask and use their brain. Listen to them. Being a counselor, if you are not genuine, it will not work. The open-end question I told you, generally start with what do you do, how do you do, could you tell me, where, but never use the word. Why is the critical? If I ask the boy, why do you masturbate? Then his guilt feeling will still go into it. So why should we always avoid it as far as the why is concerned? Gather lots of information with the women and encourage this discussion. So you understand what is happening. Now close-end question, does it start with? Is it that you are masturbating? Are you vegetarian or non-vegetarian? Are you doing anal sex also? Did you do this? What is it? Gather lots of specific information quickly and tend to close down the. So you use the open and close-end question once you go to the clinic. Yeah. Just try to find it out. All those things are very different. So never take it up and think. Ask them what do you mean by kamzori. Each one have a different answer to that. Then confrontation. वो बोलते कुछ है करते कुछ है. It's an art. And the best one was done by
there is a lady, I keep on forgetting her name, and what she used to say, बड़े बड़े लोगों को इंटरव्यू होती है कि मैं बड़े सम्मान के साथ आपको कहना चाहूँ कि आप जो कह रहे हैं वो बिल्कुल गलत है, आपने पहले ये कहा था और अभी ये कहा। So confrontation does not mean you are wrong or you are doing, don't try to put a finger. Say that, please excuse me, आपने कहा कि आप जाके घर में ये होमवर्क करेंगे, सेक्स करेंगे, but you are not doing it. Can you tell me that I am right because your partner is saying could be me? So it is pinning them down with the respect. Now, here and now, कोई problem ऐसा हुआ तो इधर ही निकालना है. So initially, disclosure, depth of discussion, commitment and action. Now focusing, my problem later I will. So what is the first problem you have to see? Put down and then ask them, what do you think, what is the first, second and third? Mother-in-law का है तो वो एक दिन में solve नहीं होने वाला. And we don't understand. सास भी कभी बहू है इतने सालों से कर रहा है, वाइफ कर रहा है. There is always a conflict going on between this. If you know about the Marwadi families, however educated person, dowry things will come up. So many small things are there. So that's why I said all knowledge of various culture is very, very important. Now, feedback. Every time at the end of that, before you give somebody, ask them a feedback. Okay, bhai, aapne jo bola, what do you think about it? Then you decide the goal, action, and the result. The best part is deciding the goal. Unless and until decided goal, you will not be able to do it. As I said, that it should be smart goal. Remember this acronyms. S stands for specific, M for measurable, A achievable, R rewarding, and T is a time based. If you remember this, now I'll give you an example so you'll have more clarity. How it is specific. For example, I will get fit. That is non-specific. How I will get fit? Will I go to gym? Will I go to dieting? Will I do some operation? Instead of this, I will run. So it is a specific. मैं कहीं दूसरे नहीं जा रहा हूँ, स्विमिंग को नहीं, ये नहीं हो. Then measurable. I will do more often. What do you mean by more often? आज किया बाद में 2 साल के बाद में करूँगा, बाद में next 2 साल के बाद. No, more often means it should be very clear. I will do this running twice a week. So it's a measurable. Achievable. मैं बोलूँगा मैं बॉम्बे में 32 किलोमीटर का होता है. I say I run 32 kilometer marathon. It's not possible. I would say I run for 2 miles. First we may start at, I will run from my home to the gully camp for a week. Then I'll go up to station. Then I'll go to the next suburb. And then I'll go to Bandra and then to Dadar and then to Church. So it should be very easy. And so that I can finish marathon. And timely at the end of 2024. So December 31st को मेरा ये काम हो जाना चाहिए. Now termination. So many times now what they say, जब वो ऐसे आके डॉक्टर सामने देखेगा फोन कर टाइम तो I won't be worried. But if he says that sir there is now 15 minutes left of time, hurry up. So I'll say there are 10 right now. I know that. So you are given me 40 minutes and I told you.
Actually 40 minutes are over.
Behavior.
Go ahead.
Cognitive, affective. Your goal should be very clear at the end of goal what you want to reach. Now at times you need a referral to do. This is the advantage of doing the practice over there. When you do a referral, I have to send to a gynecologist, I have to send to a nephrologist, to skin specialist, to a psychiatrist. So this is very, very important over here. Now, as you know, I won't be talking about DSM. This is a very important slide for all of you. Common sexual myths, masturbation, Garth syndrome, corpus gland secretion. People come for sex cloning, expectations of sex act. This is a marathon. Penile size anxiety, breast size, homosexuality, orgasm and AIDS. And I have put a word over there, that is a mythical word. Phoenix, it burns itself. So the older myths are dying and now more and more people are clear that younger people get masturbation is normal. But other myths are coming down. So over there. Now there are, apart from problems, sexual concerns are. बाजू में पापा मम्मी सो रहे आवाज आ रही है दरवाजा बंद करेंगे तो क्या करेंगे एडजस्टमेंट ही इज डूइंग अ नाइट जॉब शी इज डूइंग अ मॉर्निंग जॉब ही वांट्स ट्वाइस और थ्राइस अ वीक एंड शी सेज वंस इन अ 3 वीक dysfunction and paraphilia with this practice or other couple therapy. There is nothing like an uninvolved partner. And I can tell you, with the Burkha people, they have given the Burkha women has given much more information because male are the hypocrites. Their whole esteem, self-esteem is in their panics. तो मुझे बोलना पड़ेगा कि मेरे को सेक्स प्रॉब्लम से इसे बोले कि मैं धरती में समाचार Sexual history, Prakash has already talked to you. Visit, I told you, we must learn. Education देना है. You will be surprised, as I said, you keep a dolls and other things. People do not know कि कॉमर्स क्लिनिक को इनको समझते कि मेरा लीकेज स्टार्ट हो गया. Because दिल्ली में जाओ तो सब लोग क्लिनिक में सब लिखा है कि जवानी में की हुई भूलों के लिए मिली. They are all gold medalists. They have got facts, what to do, facts with sex, I don't know, air conditioner. And Ryan का photo दिखाता है. Then where to do? What is the importance of clitoris? Even educated people, they do not have a wife. Then male sexual response, I think this is the most important part to teach. What is, how the desire is there, how exactly, what will happen, what will affect it. And women can do, and women again, 33% of the women, they have never reached an orgasm. Now these are the women comes up with the backache, white discharge, chirchirapan and all those things. So your ear should be open. You don't have to have gadgets to start a sexual practice. What Prakash was saying, dolls, so there are beautiful art manicure available. And 80% of the, she's lying like that and he's trying to do from here. What he said very correctly, I use the same thing. कि दोनों को आँख बंद करने को बोलता हूँ, आप खिलाइए उतना तो उतना मुँह कहीं इधर जाएगा इधर नहीं वाला जाए. But he has to indicate which state. So let the woman open up her vagina, hold his penis, and she has to put 1 or 2 kilo and then try to say enter. And now you enter and don't park and stay. Start with the vagina. उसमें बाहर भी कभी निकल जाएगा, डिस्चार्ज भी हो जाएगा. This is the practice cycle. एक दिन का नहीं सीखा. गाड़ी सीखे तो सिग्नल तो गाड़ी बंद हो गई और ग्रीन सिग्नल आया तो डर हो जाता है. Sexual behavior, what is said about the practice and other things. Very common. Mutual masturbation, nudity. Many people gave a consent. I had a girl, when I told her to take a photo in the bathroom without the clothes, right next to her, I had never done during my life. So be comfortable with your nudity. What Gandhi said, a customer is the most important. Basically, in our premise, is not dependent on us. Anybody comes to you, client, they are not dependent on you. They have 20 more people to go. We are dependent on you. He is not an interruption or our God. He is the purpose of it. He is not an outsider of the business. He is a part of it. We are not doing him a favor by serving him. He is doing us a favor by giving us an opportunity to do so. So your client, as I said, unconditional, but again you be careful. They do not manipulate. I would have given it 10 examples. Wife will say, husband ko aisa bolo, husband will say, no, you go to sit in front of me and talk to me. That was that lady I was saying was Nalini Singh. Listen to her. मैं आपको बड़े सम्मान के साथ वाडिया साहब कहना चाहती हूँ. आप जो कह रहे हो उसके साथ में सहमत. There is a line written on the Parliament of UK that to allow, I may 100% disagree with you what you are saying, but to say that I will be right. Last word which I want to tell you, whenever they come, ask only one question. Second sentence, singly. और अकेला अकेला लेना है and then together what are you feeling. And the last slide what Prakash showed, 4 questions. I think if you learn that, that was a beautiful one. And they are the people who will tell you okay, what is the problem, whether pleasure hota hai, what they want, and we are in the other thing. I'll give you one example. A young couple came when I was doing a general practice. So my sexual interest, so I was doing. So they said, "Sir, we want to meet you and we are getting married." So I was very happy. 2 घंटा मैंने उसको सुना दिया सेक्स की क्या होता है क्या नहीं. बोला सर हम तो कर चुके हैं. We wanted a certificate for 15. So don't just jump and do this. And same thing with my son who is a Shanraj. 3 or 4 years and he said, "Papa, from where I came." I was extremely happy. Sexologist बाप को बेटा ये पूछ रहा है. पूरा सुना दिया सब कहानी. So Papa, I know it. But Vadia's son said that he came from Delhi. Na's son said that he came from New Bombay. And Prakash's son said that he came from Palanpur. I just wanted to know where I am. So don't try to judge something. There is always another day. कोई अगर मुझे बोले कि if I don't allow anybody who talks negative, and I will give you within 3 days. You tell me when a paper exam में पूरा blank छोड़ा है. I'm not going to do any hanky-panky things. And then also I said I will pass. How will you come and tell me? And whoever says I'll give them a category. I have done lot of workshops and I teach them this is the Bangladesh and I gave them a homework के घर पे जाते जाते कोई से कल क्वेश्चन पूछता और वो रिक्शा वाले को पूछा सेक्स का क्वेश्चन. रिक्शा वाले ने गाड़ी स्टॉप किया बोला बदमाश है. You be very careful where you are doing it. Lastly, these are the workshops which I have conducted. Really was 2004 recently, and that was 3.5 hours of communication. What I have given you is just a trailer of it. Even 2 or 3 points which you take it, I think you will make changes in your without anything in the pen or a pencil and a paper. 3 checks and no table, you will be able to do. Wish you all the best. Thank you very much for
Lord, yes. Thank you.
Next speaker.